Hi guys, so today is Monday, April 6th, and here with a few updates for you. The good news is I think today will be a little bit shorter, so you don't have to go get your glass of Cabernet or a chocolate chip cookie or whatever it takes for you to have to sit through my messages. But a few things I want to talk about today. One is that we did an update on Friday afternoon. And then after we put that update out, the CDC came out with more guidance related to cloth masks. Their guidance is that essentially wearing a cloth mask in a public place, like a grocery store or a pharmacy, places you should not be, is recommended and can help with a reduction in community-based transmission. And they consider it a voluntary public health measure. So we're taking that maybe a step further, and as of today, starting with providing cloth masks to 100% of our employees, unless they're already wearing a medical mask, a surgical mask, or an N95 mask. And that is not instead of physical social distancing, but in addition to. So big thank you to all of you who have been doing some sewing or reaching out to friends or family who may be doing some sewing. We are so appreciative, and we'll start with masking our staff because, as we know, we're the risk right now. We're the potential for bringing a germ in. We'll mask the folks who are living in our healthcare communities, so in assisted living or memory support or nursing care. And we believe that based on your sewing efforts and some donations that we're getting in, we should have enough to provide a cloth mask to all independent residents by the end of this week. So we're on it. You're on it. Thank you so much to all of you who are sewing. I don't know why you're watching me. You should get back to work. But really, thank you. You're helping, and we need you, and you're coming through. So thanks so much. A few other things I want to say. The CDC has talked about the fact that some of the folks who are testing positive in nursing homes, so you can't read the newspaper right now without seeing positive cases in Massachusetts, like in tons of nursing homes. And some of that has to do with the fact that people live in a tighter environment there. And some of it has to do with the fact that there are people who are testing positive who are asymptomatic. So not having symptoms but still being positive allows you to potentially be a virus spreader. And what we realize there is that, for those of us who are staff, we can't be 100% sure. We can test for symptoms, but then we have to do other things to mitigate any risk. And so those things are social distancing, the 6-foot sort of barrier between you and another person. I know it's hard. I'm going to say this 2 times a week, every week until we're past this virus. Stay away from one another. Do your best. Scooch back instead of scooch forward. It's okay. For now, we don't want to be close to one another. In addition to physical and social distancing, the visitor restrictions, which obviously is what we're recommending. I know that's hard. Your family comes to drop something off and you want to run down and just say thank you. Maybe just say thank you from inside your apartment or from inside the building, or even better, give them a call, FaceTime, tell them how much you appreciate it. But anytime we're potentially bringing other people into campus that don't need to be is not a good thing. So visitor restrictions. Resident testing we do in our healthcare centers, we do test for symptoms twice a day. So anyone who, we check everyone for respiratory symptoms and temperature twice a day. We do the same thing with our staff as they come into work every day. And obviously we exclude any ill staff. So if people don't pass, they're sent back home. And then enhanced disinfection and hygiene practices within all of our common areas. So every high-touch area, everything where you might be putting your hands, that's what we're disinfecting on a very consistent basis. So cloth masks are in addition to social distancing or physical distancing. They're not instead of. So if you're wearing a cloth mask, it doesn't mean you can be hugging your buddy. Keep away from one another for now. It's what we need to do. The last thing I just want to touch on is we have started to hear about other nursing homes in the state of New Hampshire who have had some positive outbreaks. And I guess I just want to weigh in on that for a second. This is just an insidious disease. The virus is hard to pin down in terms of symptoms. There are people who are asymptomatic or pre-symptomatic for a long period of time who may be bringing the virus with them. There are various symptoms that people are presenting, so it's not one like clear defined set of symptoms. So it's a tricky one. And I guess what I wanted to say about some of our friends in the industry, there's a few other nursing homes who have reported positive cases. No matter how it gets relayed in the media, this is not a product of poor quality. It's a product of a crafty and insidious virus. And what I hear, because we are on calls with a variety of state organizations and other member organizations, and that sometimes that's me and sometimes that's our clinical people, these folks are doing all the right things. And they're still having some outbreaks. We have to prepare for that. I want you to know we are preparing for that. And we are, I got an email from a resident yesterday who paraphrased my Friday memo to say, we're praying to heaven and fighting like hell. And I think that's a really good summary of what we're doing right now. We will do everything we can to keep you safe, to keep you healthy, and to keep this virus out of our communities. And we will be prepared in the chance that that we're not able to do that. So I think that's where I'll end today. I appreciate all you're doing. Sewers, thank you. Those of you who are getting really good at maintaining a physical 6-foot distance between one another, thank you. Those of you who are still working on the difference between 3 feet, 4 feet, 5 feet, and 6 feet, keep working on it. Make yourself a number line, figure out a measuring tape, whatever that might be. But it's really physical distance and our consistent and enhanced disinfection and cleaning. Those are the best things we can do right now. And that's what we're doing for you, for our staff team, and for our community. So this might have been long. I told you in the beginning it wasn't going to be, but I miss you guys. I have words that I want to share. So we'll see you soon. Wash your hands, stay apart, and stay safe.